So I'll palpate the muscles and mark up, explain a bit more about the actual technique. Okay, so usually start with the glabella when we're treating. Just like to be systematic or methodical in which muscles I treat first. So I do glabella first, and then I do the frontalis muscle, and then I treat the oculi. The glabella, as I mentioned before, consists of the procerus and the two corrugators. So when we mark up the procerus, it's very easy to mark up. It's just, if you lift it, you can see the belly of the procerus muscle. It's got a deep belly. It's just right there in the middle of it. If you like to have landmarks, you can imagine a cross between this area, which is sort of the medial canthus area, to that eyebrow, medial canthus from that side to this side, and X marks the spot. So you can, give yourself a landmark, but it's pretty straightforward. If you ask your patient to frown, and you lift the belly, it's just in the center of that. If you were to treat it the lower you treat it, but make sure you're still in procerus, the lower you treat it, the more likely you are going to get a bit of a lift medially of the eyebrow. So that's just a little tip. Now going on to the corrugator muscle. The important thing here is frown for me. If you want to palpate that muscle, you can. And you can see the head of that muscle is thicker than the tail of it. So it's a bit like a chicken fillet where you've got the thick part and then it tails off. And as it tails off, it gets more superficial. So you mark up where you expect that muscle to be, and then double check that you are at least a centimeter above the bony orbital margin. That's really important. So marked up, and you should have symmetrical. So we always check at the end, so I'm marking up, but I will check in the end that these are symmetrical. The no-go zone here is that you should not inject lateral to the mid-papillary line. So if I place a line just there to indicate where the mid-papillary line is, we should not inject lateral to that. So I'm making sure that I'm well within the medial aspect of this line. The only time we will inject lateral is if we are injecting the frontalis muscle, and by this point we are at least 2 centimeters above the bony orbital margin, and that is safe. That's where you are in frontalis, but you should not be in this area because you have then got a chance of eyebrow ptosis, which is eyebrow droop, or even lid ptosis.